Okay, maybe we can start recording and maybe we can start introducing ourselves. First of all, I'm going to introduce myself. I am Kazuhiro Tajima. I am medical doctor, and currently I am one of the CEOs of Amir Group in Spain, and I am currently the chief of the division of aesthetic medicine in Spain. And today we have here Dr. Gurnam Birdi, who is our new coordinator of our Master of Aesthetic Medicine. It's an international master course. Everything is in English, translated and dubbed to English. And here also you have Yaiza, who is the project manager and one of the leaders of the aesthetic medicine here in Spain. So also, Yaiza, you can say something to our followers.
Yeah, thank you, Giro. It's a pleasure to be here in our first webinar with Dr. Birdi, BAMAC president and one of our brand new coordinators. So it's a pleasure for us to have you here, Dr. Birdi, and we cannot wait to see what you have prepared for us.
Thank you, Euro and Maria. It's an absolute pleasure to be here today for this presentation. And hello, everyone else. Good evening, good afternoon, good morning, wherever you're calling in from. Apologies, I can't see, but hopefully you all enjoy maybe the next 35 minutes of the presentation that I prepared, where I will be talking through the trends in aesthetic medicine. Now, there's not anything in these slides that is clinical, so don't expect to be leaving here expecting to learn an injection technique or some anatomy. This is more just to try and highlight certain trends that are now up and coming within facial aesthetics. So don't want to bore you too much on this side, but a little bit of background about myself. And it's an absolute pleasure to be now collaborating with Amir Group over in Madrid, where I am the honorary professor for the international course that we'll be running, which I'll give more information on towards the end of this presentation. So without further ado, what we'll cover over the next 30 or so minutes is just a quick introduction about the upcoming trends, and then actually go into a little bit more detail of what they are. And then we'll have an opportunity at the end for questions and answers. Now, I don't believe you can ask questions as I'm going through, so maybe you can use the chat icon where you can just write me a question, and then I will try and answer them towards the end of this webinar. So, looking at the global aesthetic market, I mean, these figures are actually quite phenomenal when you try and take into consideration that, let's say, a couple of decades ago, they were just a fraction of these figures. And we can see that a couple of years ago, over 6 billion is what this market was valued at globally. And we can see here in the next 8 to 10 years, we are expecting an increase of almost 400% here. And for those of you know that about compound, which means 15.5%, there's an increase in addition to the previous year in terms of market value / revenue. So it's an ever growing, booming industry that we are in, which I'll talk a little bit about more and compare it to surgery later on. But why are we seeing such a trend is predominantly because of the rise of social media. And nowadays there's various platforms. There's more platforms than I can think of. You know, there's various means of being able to compare yourself with others, or look at celebrities, or even just look at the latest trends that are occurring. And we are getting older as a population. You know, gone are the days where the average lifespan used to be only around, 50, 55, 60. People over in Japan, I think, have the highest lifespan around the world, with the average being well into the early 80s. But we are getting older, and maybe a little bit too old. And what we're noticing is we are becoming more and more self-obsessed with how we look or how others perceive us. And again, some more factual information here, which is actually very relevant to facial aesthetics, because it explains why we have such a big demand. And it's also quite, some light at the end of the tunnel, especially for some of you that are trying to get into aesthetic medicine and have this notion that, oh, it's a little bit saturated, and I don't think I'll get very far in the career. These figures that you see in front of you are actually inspiring. And for those of you that have an artistic side, it's a great idea to be getting into this career path. So again, just looking at these figures, 700 million people worldwide just a few years ago were over the age of 65. And some of my patients are over the age of 65. In fact, some are even in their 80s that come and see me for treatments. So what we are expecting now in the next few decades is this to be doubled to 1.5 billion. And again, just looking at a few more statistics over here, we can see that the overall percentage of the amount of people aged 65 and above will be on the rise. So what this means is that we're all getting older, and because of things like social media, there's going to be an increase in demand for the following things that you have here. Now, this was an informal study done by a journalist who actually worked for Yahoo, and then published this document. And we can see that a lot of people are predominantly finding treatments for facial line correctment. So this is your typical upper third Botox areas that we would typically do. And then also we can see lip enhancement is quite popular, as well as restoring contours and volume to the face, which would include things like jawline filler, chin filler, or cheek filler. So quite a nice slide here where we can see that there's an increasing demand. So with what I've just covered over the last couple of minutes, if you piece this all together, so there's increase in demand globally because of social media and social media platforms. And we can also see here that more and more people are becoming self-obsessed. So why should we be offering non-surgical measures? Now, in some countries, unfortunately, aesthetic medicine hasn't been given its own limelight, and it's almost overlooked, whereas in other countries it's become its own discipline, and rightly so, because surgery is essentially cutting and lifting and taking things away, whereas non-surgically we are essentially putting things in. And another reason for some of you who are considering to get into the career of aesthetic medicine or developing yourselves is that you shouldn't be afraid of those overpowering medical colleagues. And yes, rightly so, plastic surgeons. Just because you are a plastic surgeon does not necessarily mean you are going to be amazing or great with a knife, with a syringe and a needle. So plastic surgeons, again, great at chopping things up, creating a lift, and augmenting, etc. However, non-surgical measures also is an art and a discipline in its own right, and it requires appropriate training, both clinical and non-clinical. So let's look at some of the reasons why the trend is also shifting from surgical to non-surgical. So some of the advantages are there's no downtime. The amount of patients that will be at work and maybe during their lunch break, they'll say, right, can you fit me in for a quick rhinoplasty, or can you quickly do my upper facial lines, is becoming increasingly popular. So there's very little downtime. You can come, get the treatment done, and boom, you go back to work. There's no scarring. So you don't need to worry about things going wrong to an extent. There's no obvious scarring. You don't need to hide things with excessive makeup or having your hair down. And it's always an advantage, because scarring in itself, again, if you don't have proper healing, can lead to other problems, such as infection, but also bad cosmesis. It's also less expensive. Now, with the current climate, we've got inflation that's happening worldwide. I've just been over in the far west in North America. I've just come back from the far east, and inflation, I am literally witnessing this everywhere. And so again, another reason for the demand that we are seeing in facial aesthetics. So it is less expensive, which is always going to be a plus side. It's reversible. Now, some of my plastic surgery colleagues will argue that actually surgical facelift might be the better option. But what we need to try and think about here is we're still going to age. So let's say, for example, a surgical lift will give you a good 8 to 10 years. In those 8 to 10 years, you're still going to be working, having exposure to sunlight, excessive exercise, you might have poor diet, you might be a smoker. The point is you're still aging and you're still losing collagen every single year. So actually speaking, even a surgical treatment option is never going to be permanent. Fine, it might buy you a few more years, but it won't be permanent. And the fact that it's reversible is great. If we think about Kylie Jenner, a few years ago, pre-COVID, she had her lips filled and the demand for lip filler became quite popular. A year or so later, what did she go and do? She went and dissolved them. And then all of a sudden, you could have seen the trend in the lip filler market almost took a little bit of a dip. So this means that what we are doing essentially is copying others. We are looking at others and we are seeing what the demands are, and then we are imposing them on ourselves. So the fact that something is reversible, I think, is a great thing, because today somebody can say, right, I don't know, Kylie Minogue's got great cheekbones. Now I want to have great cheekbones. Next week she dissolves them and she opts for a very square masculine look. Then even our patient population will also ask for the same thing. So actually things being reversible is not necessarily a bad thing. And this is the last point that I've added, which is a stepping stone. So what I mean by this is for essentially those patients who either have the finances for surgery or they are considering surgery. Sometimes it's useful just to give them the option of saying, well, hang on, let's assess you and see if things can be done without cutting and chopping and making it less invasive, and seeing if you're happy that way. If not, of course, go for surgery. So the question isn't which is better, because there's always going to be a place for surgery and there's always a place for non-surgical measures too. It's all about patient selection and giving the patient various options, and obviously they can go and make an informed choice. So I did touch base on social media earlier on, but COVID had a massive impact. The amount of women, men inclusive, but predominantly women, that are now coming to our practices basically saying, ooh, I was having my Zoom meeting with colleagues from work last week, and I've noticed this facial line and a fold come up over here and a big beauty spot on my forehead, which I've never seen before. And they're coming up with all these weird and wonderful observations about themselves. And you know what? In a way, thankfully, it was to Zoom. And I suppose this is probably, for all aesthetic practitioners out there, probably one of the good things that came out of the whole pandemic. So good for business, I suppose. So COVID did have a massive impact. And the reason this was the case was because we are using still, and we were using our facial appearance to convey both messages as well as emotions. And I'll give you a clinical example. If you look at the lateral canthus, which is the lateral aspect of the eye, if this is heading inferiorly, so if you have droopiness of the lateral canthus, or better still, droopiness of the lateral oral commissure, then this is going to be perceived as somebody who is tired. It's going to be perceived as somebody who is getting older, they're aging, they're tired, they're unhappy, because it's almost like a downward circle. So this is why these are two places that I often look at when deriving at a treatment plan for a patient, which is the lateral canthus and the oral commissure. We want to essentially flick these corners superiorly, so therefore you can portray a message without even opening your mouth, without even speaking, that you are actually quite a happy soul and you're very relaxed and you're very positive. So again, things like Zoom, obviously here today we are using Microsoft Teams. It's pretty much focused. I'm not sure if you can see me or not, I have no idea, but again, it's very much self-focused, and it's pretty much zoomed in into your face. So more and more people are becoming obsessed, rather, for use of a better word. Fake versus natural. Here we've got the famous Mona Lisa. I was quite disappointed when I saw this in Paris, actually, because the original painting is very, very small. Again, perception, which is what our industry is all about. And as much as there are going to be people out there, men, women, trans, all sorts. I think there's like 5,000 different genders out there now. It doesn't matter who you are, everybody's going to perceive beauty in a different way. What we need to remember is this is essentially our work that is being advertised as they are walking up and down the streets. So if you do want to make your people look like this on the right-hand side, by all means, go ahead and do so. But remember, we are both artists as well as medical healthcare professionals at the same time. We are basically blending science with art, and our goal is to maintain beauty, and we are trying to slow down the process of aging. We won't be able to stop it. We just simply want to slow it down. So remember, we want to try and keep things very natural. Tweakments, a word that I have often started to use recently in my clinical practice. So two things, what a tweakment actually is. It's non-surgical. So if you're going to have a general anesthetic and go under the knife, obviously that's not a tweak. So it's non-surgical and it's minimally invasive. So something that can be done superficially, whether it's chemical peels or intradermally, skin boosters, or even Botox, which is intramuscular, and dermal fillers, which potentially can be a lot deeper. So a nice little term that we can start using in our clinical practice, and often patients have heard of this before, and if not, and it's a fairly easy word to come up with, and patients often just do want a little tweak. Now, of course, somebody comes in and they pay for 5, 6, 7 mils of filler. That's amazing. You have a full face transformation. Of course, we like patients like that. But then there's also those that want things very subtle and very natural, and that's why we do these little tweaks. What is sometimes quite frustrating within this industry is when a patient comes in and they say, right, I want 1 mil lip filler. And then we often do the 1 mil lip filler, or they'll come in and say, I want my cheeks doing, and we do the cheeks. And I think what we need to start doing is break out of the mentality of listening completely to the patient, address their concerns, of course, and then derive at a treatment plan, which is going to be, one, ethical, as well as two, help you from a business perspective too. So I think we need to train ourselves to be better treatment planners as opposed to just good listeners. So experience, this is quite a nice little saying here, and it's almost like a little vicious circle if you think about it. Good judgment comes from experience, and experience, well, actually that comes from poor judgment. And the point I'm trying to get at here in this slide is patients are often coming to you for an experience nowadays. You know, gone are the days where, oh, I've got a nasolabial fold. Can you just fill this line for me? And off you go. Now they're coming in, you know, they want that coffee, they want a little chit chat, they want that facial to be added on post-treatment. So they're coming in for the experience. And this is what we need to focus on. And I always say when I'm teaching is, you know, I can get somebody come in and, you know, see them in 5 minutes and do the lip treatment, for example, and do the best job in the world. Or they can go to somebody else who spends half an hour with them for the same treatment, but they have a slightly poorer result than I do. Which do you think the patient's going to go back to? Not necessarily me. There's a good chance they're going to go back to the other person. Why? Because it's about the experience. And it's the experience that they remember, and it's the experience that causes them to advertise you via means of word of mouth. So good judgment comes from experience. So let's look at actual trends with the industry. Like I said, there's nothing here that I'm going to be clinically teaching, but just going through a few little pointers here or there and things that you should think about in your clinical practice that we should be doing. And if not, we should be looking at means of finding training for such things, which I'll talk about right at the end. So neuromodulators. What is a neuromodulator? Basically affects the chemical balance within the nerves and the muscles. So we're talking quite simply here about Botox. One of the first things that is growing in trend is a brow lift. And like I said, I was last week over in North America, and just last week, I've literally only just got back this morning from Southeast Asia. It's something I'm getting asked all the time, a brow lift. Wherever I go, they want a brow lift. And the whole spocked look now is becoming increasingly popular. So around 10, 15 years ago, you create a Spock eyebrow and that was a complication. Now, more and more people are wanting this spocked eyebrow look. So a brow lift can be done chemically. By all means, it's not my favorite way of doing a brow lift. I prefer doing this with dermal fillers or even thread lifts. However, the brow lift, like I said, is probably the least invasive way of doing this is with Botox. So a very common trend that we're seeing. Lip flip. So something else I was also asked quite a lot of, how do you perform the lip flip? We seem to know why we do it. Fairly obvious, right? It's in the name. You flip the lip, you see more of the lip. Is it good? Is it bad? At what point do you say no? And at what point do you do lip filler instead? So in summary over here, if the patient were to smile and the top lip was to roll inwards, then we have a bit of a problem here. Of course, it's not going to be overly desirable. Therefore, we could do the lip flip. However, if they just naturally have thin lips and they have no rolling in problem or lifting problem, then maybe lip enhancement would be a better option with lip fillers. And one other term that is commonly thrown about is a gummy smile. So very similar in terms of how it's managed with lip flip. So a gummy smile is done in the same way as you would manage a lip flip. You're basically injecting toxin into the strong levators of the top lip, and you're going to allow more red of the lip to be shown. So in terms of filler, again, this is going to be a better option if the patient is wanting contour and the patient is wanting volume. Now, from experience, I don't think a lip flip with Botox lasts a very long time. It will probably last around the 6 to 8 week mark at best, whereas your lip filler could last from anywhere between 5 and let's say 8 or 9 months. So I think this is something that we need to make sure that we educate our patients, because they will go on social media, they will see all these big, lovely, fancy lips, and in the caption it will say, I've had my lip flip Botox. So I think patients will present saying, oh, I've seen this, I want this. Our job as medical healthcare practitioners is to educate them that it's not a problem. We can definitely do it for you. However, just remember, one, it's not going to last too long, especially in a very dynamic area. And two, if it takes very well, it may actually affect their smile. So it actually contradicts what they wanted to have done in the first place. So again, not all trends, I believe, are very sensible. They do have their role, they do have a place, but not all will be overly accurate. And something else that is now becoming more and more popular is jaw slimming. I'm working quite a lot now in London and the surrounding areas, and I am teaching a lot of dentists, and it's quite surprising actually how for bruxism, which is teeth grinding, Botox is not often used. But more and more patients now, again, because of social media and because of good patient education, are becoming aware that we can actually now not only stop teeth grinding, which is a medical condition called bruxism, but we can also actually improve their cosmetic appearance. Now, one of the things when I'm assessing a patient's face, which is not for this presentation, this will be for a future webinar, is what do I look at? And this is the number one question that I get asked wherever I go in the world. When doctors come up to me afterwards, they say, right, we can learn how to inject the cheeks or the nose, or we can learn how to put Botox here or there. But what is it in those 30 seconds when I lay eyes on a patient that I assess and that I'm looking out for? And that's something that hopefully we can teach you, in due course, but it's beyond the scope of this presentation. But one of the things that I look at the beginning is the overall shape of the face. Now, there is no one shape that is desirable. You can look at people like, I don't know, Angelina Jolie, who's got a very square face, Margot Robbie, who's got more heart-shaped face, Mila Kunis, who's, again, more of a square face shape, Halle Berry, who's got more of a diamond face shape. So not one shape is the most desirable. But again, what I am doing is just looking at the overall shape of the face and knowing that I can go from a square to a heart shape by Botoxing the large masseter muscles. And it might seem quite easy, just putting Botox into the masseter muscle, anywhere between 3 and 5 injections, but actually it's not. There's a little bit more to it. We don't want to create any inadvertent spread here. We want to make sure that we are in the right plane, and not all injections are done deep, just because of the anatomy, again, which I'm going to probably save for another webinar. Skin boosters. So something that people are hearing a lot of now here in the UK in particular, It's even on the radio. You know, I could be driving and all of a sudden I'll hear an advert for Profhilo. So it's becoming more and more readily available in terms of public knowledge. So it's not only just social media when you're scrolling on your phone, but it's also actually even when you're driving to work in the morning and whatnot. So a couple of the very common ones that we are currently seeing here in the UK market is Profhilo and the increasingly popular Jalupro. Now, both are great and both have very particular indications. Now, remember, these skin boosters primarily are HA, hyaluronic acid. What is the primary indication of hyaluronic acid? Well, it's straightforward. It's hydration. So again, patients will often come in, and we're talking about trends here, remember, nothing clinical. Patients will often come in and they'll say, we've seen a picture like this. Now, this was done by one of my colleagues, so I'm not going to take credit for this, but an amazing result 4 weeks after her first treatment. So she's had her first treatment, as you can see on the left. It was actually done with Jalupro. And this is what she looked like after her 4-week review. So an amazing result. I'm sure you'll agree. Now, patients will often see something like this on social media and they'll come in and they'll say, right, this person had Jalupro. You know, this person had this or this person has that. It doesn't matter what they've had done. They'll just say, right, I want this. And this is what the dilemma you're going to be presented with. You start thinking, well, how? And I think what we also need to start doing is educating patients. A skin booster, as much as brands like Profhilo may say and may advertise, oh, it's going to tighten your skin, it's going to lift your face. Well, actually, let's take a step back or two. It's not. Okay, so I'm sorry to burst anybody's bubble here, including Profhilo's bubble. It's not going to lift your face. And predominantly in here, in these syringes, you have HA, hyaluronic acid, which the molecular structure of it makes it very hydrophilic, which means it attracts water. So yes, it gives you very subtle volumization and very small amount of collagenesis, but not enough to actually create a lift. The reason why this patient's got a very great result, I'm not a brand ambassador of Jalupro, so I'm not sponsored by saying this. It is just very factual information, is that you have your hyaluronic acid chains in Jalupro, but you also have a high density of amino acids. Amino acids, in particular glycine, proline, leucine, and lysine in high quantities, and essentially what they're going to do is collagenesis. A little fact here, 70% of the human body's collagen is located where? Guess what? In the skin. Okay, we've heard the fact that the skin is the largest organ in the body, which it is. Most of the collagen is found within the skin. Okay, but here, these are the indications: fine lines, crepey skin, to improve the texture, etc. But there's also other things that are on the market. For example, PCL, polycaprolactone. There's also PLLA, poly-L-lactic acid, which is Sculptra. Some of you have probably heard of Sculptra. I'll be at FACE conference in London at the end of this month. I'll be presenting a newer technology, not just PLLA, but PDLLA, and I'm already presenting PCL. In fact, I'm off to Riga next week, where I'll be presenting PCL. So the point I'm trying to get at by telling you where I'm going is that it's not just a national demand here, it's a global demand. And the other interesting thing here is, for the last few years, it's always been Profhilo, which is HA, right? But now, like I said, I'm presenting about PCL, I'm presenting about PLLA. So there's various other things that are not hyaluronic acid, which actually are amazing. Now, it's not about which is better than the other, or which is number one, which is number two, which is my favorite. I believe they all have a role in the industry. But what we need to take a look at is, what is our patient trying to actually achieve? And usually they've got a lot of fine lines, crepey skin, poor texture, sunspots, age spots, etc., dehydration. So usually they need a mix, which is why I said earlier on, treatment planning is obviously very important. Both of these products in particular, PCL and PLLA, are essentially skin boosters, but they are also known as collagen boosters. So they will actually stimulate collagenesis. Now, as much as there may be a little bit of evidence about collagen tablets, I personally am not a huge fan of any oral digestion of collagen. I don't think the bioavailability is going to be as high as just getting the collagen and putting it directly into the dermis, where majority of the body's collagen is residing. Remember, from the age of around 25, 26, we begin to lose around 1% of our collagen every single year. So, that's something to always to keep in mind. Okay, so we can have a patient coming in at the age of 30, 40, 50, it doesn't really matter. You can do the best treatment on the planet with dermal fillers and PDO threads, etc. But what's going to happen the second they leave your clinic? Well, they're going to age. They are aging. You guys, whilst you're watching this presentation, guess what? You are aging. We've probably aged by about 20 minutes right now. So we are losing collagen more and more and more as the years go on. Okay, so again, very, very important, this slide here, because it's becoming a big trend in the market now. Dermal fillers, been around a very long time. Well, what do? As the name says, they fill. Quite wrongly called dermal, I suppose, because we're actually often not injecting them into the dermis. They're usually either a lot deeper. So usually they're either subcutaneous or they are super periosteal. And I've basically just handpicked a couple of popular demands, again, in accordance with current trends. Lip enhancement. Let's be real, this is never going to die out. Okay, more and more people are, quite fixated about their smile, about their lips, about their teeth, which is why now dentists are becoming very, very busy with cosmetic dental work, such as Invisalign, and everything around the peri-oral region is very, very popular. And another important fact here, which I was actually presenting just last week, we often see a baby, and this is how the human brain works, right? We see a baby. What's the first thing that we say when we look at that cute little baby? We say, oh, right? It's true, right? That's what we do. We have that kind of natural expression of thinking, oh, that baby's so cute. That baby's so chubby. I want to squeeze that baby's cheeks, right? So in the same way, why are we doing that as adults? And the reason behind this is the human brain, our eyes and the brain, they are primed to see circles as beauty. Okay, so if you have a baby that's born and that looks very rectangular and very square-like, that's going to look a little bit odd, because our eyes and our brain are perceiving this as thinking, actually, that's not cute. The point I'm trying to get at here is the human eye and the brain, they perceive circles as a natural, nice, cute, beautiful thing. So what that actually means is that where are we identifying geometric circles within the face? Two places, periorbital and perioral. Think about it. The perioral region and the periorbital region. So the periorbital is a round muscular structure, and the perioral also is a round muscular structure. Just like looking at a baby and saying, oh, the baby's cute. So in the same way, the perioral and the periorbital region is very, very important. And this is why lip filler demand is always going to remain there, because we often say when you walk into a room, often you will see the person's eyes or lips. And again, thinking about circles, thinking about babies, and just piecing this all together, which actually explains why we have certain trends. Just a set of lips that I've done here as well, just to show you. Again, she's got an enhanced, just a fellow cosmetic nurse here in the UK, just enhancing her very naturally. And again, we've got to be careful that we don't overdo this. You overdo the lips, you have the risk of migration. Once you get migration, you may be stuck with this for a very, very, very long time, I can assure you. How they're actually done, again, is beyond the scope of this presentation, but it doesn't really matter. Whether you're doing tenting, threading, bolus is irrelevant. What is actually very important is, one, the anatomy, and two, your aesthetic ideal, what you and the patient are trying to achieve. Temple fillers, I don't have a slide on here because that's a whole new ball game in itself, and a topic that I really, really love. And it's becoming slowly more popular. And I can't say this is the case globally, but it's definitely becoming more and more popular in my practice. And maybe that's because of increasing patient education. Why are temple fillers popular, and why should you be advertising temporal rejuvenation? Well, one, if you have hollow temples, again, this is going to be show signs of looking aged, looking tired. Losing volume in the temples will cause the superior lateral eyebrow to droop, as well as the superior lateral skin of the periorbital region, it will also droop. And what did I mention earlier on? There were two types of corners that I mentioned: the corner of the eye, lateral canthus, and the corner of the mouth, the oral commission. So by losing volume here, higher up in the temporal region, not only will your brow drop, but also your lateral canthus. And then you start sitting on your Zoom meetings, and then you start looking at yourself, and then you think that my corner of the eye is drooping down. What is that affiliated with? Sadness, being tired, being unhappy. So again, temple filler can actually help with this. And especially for those that have had severe medical problems, whether it's chemotherapy, radiotherapy, HIV therapy, of course, they'll have significant temporal hollowing. And again, it's a very important thing to be educating. Having said that, arguably, probably the #1 most dangerous place to be injecting in the entire face. So again, if you don't know what you're doing, again, this is where sound treatment, sound education is very, very important. Now, profiloplasty, part of my talk that I was giving in Southeast Asia just over the last few days. So facial profiling, 4 things. There's 2 things that I've mentioned here, but there's 4 things that we're looking at. Forehead, very, very high risk area to inject. The nose, the lips, which we've just talked about, and the chin. So the nose and the chin. And you can see here a couple of examples of mine. And coming back onto one of my earlier slides where I talked about surgical versus non-surgical. I mean, I don't want to blow my own trumpet, right? But come on, have a look at that picture on the right-hand side. I'm pretty sure you'll agree that that is damn good, okay? That was in less than 5 minutes. No scarring, no bruising, no downtime. You can take a 0 off the end for what it would have cost if it was done surgically. That's a pretty good result. Okay, patient delighted, over the moon, very loyal, and has been coming to me for the last 4 or 5 years. So why would you have surgery? Don't get me wrong, there's the right time and place for this. But again, because of social media, people are seeing that things like this can be done. Therefore, it's very important to basically stay on top of trends. You want to make sure that you are shit hot at basically making sure that you are aware of what's popular, not just worldwide, but in your local area. And that you are secondly trained adequately, properly by professionals on how to do these things. Because if they go wrong, dare I say it, they can go very, very wrong. Chin. Some of you might think that's very unusual, especially for some of you here that are new to aesthetics. But the chin, sorry, I'm just going to interrupt very quickly here. On my screen, it says 56 minutes and that the Zoom meeting was an hour long, so I really hope that this does not cut out, by the way. If it does, guys, just rejoin. I don't really know how this works. Anyway, chin. Move on to the next slide. It defines your personality. Now, we've got a couple of examples here. We can see here Margot Robbie's chin. Very lush looking jawline. We can see another example here. Angelina Jolie's jawline. Now, some of you may argue that they look quite masculine, not a single ounce of jowling in either of these jawlines. 2 different generations. And you can see how it defines their personality. And what I want you to do is keep an eye on the next picture that I'm going to show you on the bottom left here. Okay, so you can see what's happened with this image of Margot Robbie's chin, where we've actually taken it backwards. So we've given her a malocclusion, a class 2, so like an overbite. And you can see even the positioning of the chin can really make the personality look either quite weak, quite poor, compared with what you see in the middle, which is quite strong, quite powerful, and rightly so. Thread facelifting. An example that I did probably a couple of weeks ago. Pretty good result, I'd say. Most important thing, patient selection, and then it's the technique. And more people are now beginning to offer PDO threads. On my recent travels, I've now also learned how to do what we call Aptos threads, which are actually permanently placed into the face. I don't know if any of you have ever seen these threads being done. It's quite an invasive procedure, let me tell you, but phenomenal results. And the reason the results can be as good as what you see here in front of you is what? Patient selection. Okay, that's what it all begins with. Let's be honest. Patient selection. Patient walks in, they're either good or they're not. Knowing when to say no can be difficult. But it doesn't mean you just say no when you say goodbye. It means no, you sit them down, you educate them on what is possible. You manage their expectations, as I would have done with this patient here. I would have said to her, this is what you can kind of expect. This is what you will expect immediately. This is what you expect in a few months' time. The difficult thing here with threads is soon after treatment, after a couple of weeks, they kind of lose that swollen look, that lifted look. And yes, you are right. How do threads work? They produce collagen. They slowly dissolve over the next few months, 3, 4, 5, 6 months even. They'll slowly dissolve and they produce collagen. But what did I say to you happens earlier on? It's happening to all of us right this second. We're losing collagen. We're getting older. So on one hand, we are producing collagen, but on the other hand, we're losing collagen. So let me ask you this question. Are threads the best thing that you can do for your patient? Honest answer, no, it's not. Is it a great thing to do in combination with other things? 100%. So this comes on to what I was trying to summarize things earlier on, is combination therapy will always work the best. Always. So always try and think of more than one way of treating the patient, keeping them happy, keeping up to date with current trends, and selecting the right patient. PRP can be done with or without microneedling. Again, becoming very, very popular. I think, please do correct me if I'm wrong, it was over back in the 70s, I believe, 70s or early 80s when PRP was first introduced. And then back in the early 2000s, along came Kim Kardashian, where she posted this image that you see in front of her. Using your own growth factors, various growth factors that are found in autologous blood. Okay. And again, for skin rejuvenation. It can be manually injected, it can be microneedled. The added benefit of microneedling is the mechanical trauma. And you can go potentially slightly deeper and keep it very accurate. So there's a twofold effect when you microneedle PRP. And studies are being published and are becoming quite promising. I don't believe that patients need to look like this after treatment. Most of my patients are slightly erythematous, slightly red. They might have 1 or 2 blood spots, but they don't usually look like this. I think they went a little bit over the top here, and putting PRP too deep, again, is not going to have that much benefit because you want to be in the deep dermis. And another very popular example here is for hair regrowth. Now, I often do hair transplant surgery as well. And whether you have surgery or not, guess what? PRP is going to be a very important factor for the patient. It's got the growth factors, the nutrients. You're basically watering those hair follicles and giving them the nutrients for them to grow nice, strong, and sturdy. So again, a very, very popular demand. And if this is something that you're not doing, again, we'll talk about training right at the end, but something that's very, very likely to be booming in your practice worldwide. I'm not just talking about locally here, because I know a few of you here are calling in from all over. This is becoming very popular. The amount of people, both men and women now, that are going either over to Turkey or other parts of Europe just because it's cheaper. And remember, I said one of the things in my earlier slides that non-surgical measures are usually inexpensive. Now, yes, this is still surgery, hair transplant, but it's cheaper than it is here in the UK. So again, it's not just social media trends that are important, it's also the financial aspect as well. People are looking at finances and trying to find a quick fix. But our job is to make sure that we educate them that, guess what, there is no quick fix, and things do take time with appropriate treatment planning. So certain body treatments, so IV nutrition, gimmick, not gimmick, you know what, I don't know. I was gonna say I'm a young, I'm not too sure about that, but let's just go with it. I'm a young, healthy male. So maybe I'm not gonna notice much benefits of this. I felt a lot hydrated. I felt, more alert, great stuff, However, going back to the 1960s, where the Myers cocktail by Dr. Myers was originally created over in America, if you look at the studies following this, there were a lot of positive results. Whether we were giving this for patients with fibromyalgia, now, I'm not trying to offend anyone here, but patients who have fibromyalgia can be very challenging, can be very difficult to treat. Normal analgesia or normal other oral medication, guess what? They don't tend to do anything. So, powerful studies were published where this was helping patients with fibromyalgia, whether they've had chemotherapy, cardiovascular problems. Of course, we don't put on our websites, do we? Oh, by the way, if you are having chemo or this or this or this, please come see us. No, but it's just to highlight that actually there is some evidence behind intravenous drips. But again, a bit like skin boosters, what is the primary thing we are doing? Hydrating. And it's very, very important to be hydrated. Okay. So IV nutrition is becoming increasingly popular. I think we need to be very careful here that we're not trying to correct electrolyte deformities. We're not putting in potassium or anything like that. We don't want to be giving them a heart attack, all right, an MI. So just be very cautious when you are doing intravenous therapies. Energy-based devices, EBDs, again, becoming very, very popular. Whether this is something to do with light therapy, so putting on a light mask to a patient. Often we put a red mask on to address fine lines and wrinkles, sunspots, age spots, pigmentation. But we also can use thermal-based energy devices, so lasers. Where can lasers be used? Whether it's the carbon laser facial, very popular. The fractional carbon CO2 laser, which is a little bit more invasive. And we've also got laser hair removal. Again, big demand for these kind of treatments. And I think because of social media, we are becoming, well, I was going to say almost like a hairless society. But now, of course, we've got, like I said, over 10 different genders now, especially here in the UK. Doesn't matter where you stand politically, that's what we have here. And at the same time, we've now got men that want to be hairless, and then we've got women that are now keeping their underarm hair and leg hair. So there's so much that is going on social media. Who am I, or who are we to decide what's right or what's wrong? We just need to move with the times. We are moving with the trends. We are keeping on top of what the trends are. And body contouring, something that I'm a big fan of, whether this is for example, thread lifting of the breasts, of the boob lift, or bum lift with threads, bum volumization, cellulite removal, crepey skin off the back of the arms, above your knees. There's so many treatments that are now happening outside of the face. I mean, even the neck and the décolletage becoming a very, very common problem, especially in Caucasian patients. So people of white skin color, low Fitzpatrick skin types, where you end up getting fine lines and crepey skin in the neck and décolletage. And a lot of treatments are now being devised for this, whether it's energy-based devices or peels, etc. And we've also got other treatments, whether it's aesthetic urology, the P-shot for penile enhancement, volumization, also the O-shot for vaginal dryness and vaginal rejuvenation. So even PRP is now being used all over. And again, talking about body treatments and PRP, another place where PRP is often being used in the joints. And I do this in my practice. We are injecting into the elbow joint, shoulder, knee joint to try and counteract arthritis, even into the wrists for carpal tunnel. So again, we are now entering a territory where we are becoming quite brave and almost doing trial and error with various things. Rightly so. Some of you are thinking, is there any evidence behind any of this? Well, the actual answer is no. There's a few studies that say, right, this is working or that is working, but there is no concrete evidence, such as a large randomized, controlled, placebo-controlled rather, controlled trial. Things like that do not exist, but should exist to try and standardize everything. So I will bring this to an end. So I, will thank you everyone for listening to this presentation. Hopefully you found it very exciting. Or normally I'm giving very clinical presentations, or I'm talking about full face approach or complication management. So it was nice for me personally anyway, to try and give something a little bit different to than what I normally talk about. I have my Instagram handle over here, so you can get in touch with me if you have any further questions. I have my official Amir email address for contacting me as well. So For some of you that are well trained, I suppose you can always contact me afterwards. For those of you that are looking for more succinct training, I would highly recommend that you click on that link. I don't think you can click on that link actually, but make a note of that link at the bottom there, where amirmedicinaestetica.com. And what we are doing over in Madrid is offering a master's course. Now, I think we need to just try and get one thing straight here, because when I started my collaboration with the Institute, I was absolutely shocked by how much content and the breadth of knowledge that is actually covered. So what we are offering and what I am in charge of, which is the international delegates, so I'll be in charge of the international course, is we are offering a succinct 8 or 10, so 8 to 10 month program where you are taught everything online. So we are talking right from foundation Botox, foundation fillers, a little bit more advanced, then your PRP, then your lasers, then your body treatments, then your gynae treatments, then your complications, then your hair treatments, then nutrition as well. Absolutely everything there is to know about aesthetic medicine, top to bottom, is being taught, and it's being taught online. So like I said, it's about 8 months long. You have access to an online portal, you've got assignments, you've got modules, you've got activities to do. It's done in 8 months. So you will literally go from not knowing what to do or knowing very little what to do to essentially becoming, I wouldn't say an expert, but you know, very, very advanced in the career of aesthetic medicine. So it is a master's course, by the way. So don't expect it to be easy. And then it's all done entirely online. So whether you're in Australia or America is irrelevant. There is also a 1 week intensive hands-on. Now, I had the pleasure of witnessing this a few months ago over in Madrid. Beautiful place, Madrid, and I absolutely cannot wait to go back, hopefully in the next few weeks. Over in Madrid in November, you will spend a full week, Monday to Friday, 8 hours a day, doing some intense hands-on training on literally everything that's taught in those 8 months. Now, what I witnessed was small groups in various little rooms, absolutely meticulously laid out, where you will be learning energy-based devices, carboxytherapy for peri-oral rejuvenation, dermal fillers, lasers, gynae, everything is taught Monday to Friday, 8 hours a day, and it's very, very intense. So, of course, not for the very light-hearted, but if you're one of those that, it's not an overnight fix, of course, if it's 8 months long, but if you're very, very keen, it is something that I would highly recommend. So go on the website, click on the curriculum first of all, forget the price, just click on the curriculum, and you'll be absolutely mind blown by what is actually covered. And like I said, there is the hands-on element, which is about a week long. And for those of you that are interested, probably thinking, how much is this going to cost? Is it going to cost like 20,000 euros, 30,000 euros? Well, it's actually 4,900 euros. So if some of you are from the UK, I have no idea what that is in pounds. 4 grand, maybe four and a bit grand. And then there's also 15% of that because my lovely face is attached to all of this now as well. So 15% off all of that, and you guys can do the math. So actually just under 4 grand, you can pretty much learn everything that you see on the website, which is also, like I said, not common. I don't think I've ever come across an institute that is teaching in such meticulous detail with the way that we are over here at Amir. So anyway, I'm going to stop sounding like a salesperson there because it's not what I do, but I was actually mind blown by it all. So head over to the website. I am affiliated with them. It's not been announced yet on social media, but it will be over the next couple of days, where I have the privilege of being the honorary professor over in Madrid for Amir Medicina Estetica. So you'll for sure see a lot of me. If you have any questions, hit me up. Otherwise, I will hand this back over to Euro and Maria. Thank you, guys.
Thank you very much, Dr. Beardy. It's been a pleasure to have you here. It's been a great presentation. And well, everyone else who wants to know a little bit more about our master's degree, you're more than welcome to ask every question you have or contact us or on those links that Dr. Beardy have provided you with. Thank you very much.